Welcome, and thank you for joining this Ask the Experts virtual event. What comes next? Life after prostate cancer treatment. I'm Dr. Peter Bayich, a Cleveland Clinic urologist. I'm joined today by a panel of men's health experts. We're here to answer your questions and share insights on sexual health and intimacy, bladder and urinary function, and emotional wellness and recovery. Before we get to our questions, let's meet our panelists. They'll briefly introduce themselves and share some common myths about prostate cancer recovery. We'll start with you, Dr. Bolle. Tell the audience a little about yourself, how long you've been practicing, where you see patients, and what your specific specialty area of focus is. And lastly, what's one myth you often hear about prostate cancer recovery?
Thanks, Dr. Bayich. So my name is Dr. Revati Bolle. I am a urologist at the Cleveland Clinic, and I subspecialize in male infertility and male sexual medicine, and I do have a special interest in urologic cancer survivorship. My locations that I see patients are the main campus and also regional sites like Beechwood and Independence, as well as Middleburg Family Health Centers, and I've been at the clinic now for 4 years. So
what's one misconception that you feel is common amongst prostate cancer survivors?
I'd have to say the biggest one that I've heard and that I want to dispel is that you have to recover for prostate cancer alone. I do think that there's a big community of people that you'll find want to help support you along the way. There's a huge group of doctors, of therapists, of friends that you make along the way as you're recovering, and I really think it's important to lean into that group.
Thank you, Dr. Bolle. Now on to Dr. Gill. Tell us about yourself and what's one myth you often hear about the prostate cancer recovery.
My name's Brad Gill. I'm a urologist here at Cleveland Clinic. I've been in practice about 8 years, and my specialty is also men's health. I practice largely out of Hillcrest Hospital, the Twinsburg Family Health Center, and the main campus as well. Myth about prostate cancer, if I had to pick one, is that it can't happen to you. Prostate cancer is incredibly common, and one thing that I think about is how guys need to talk about it more. And that's really the big thing for me, you know, the fact that us guys don't talk about our health and we're not open with each other. That is the myth that I'd like to see busted. In terms of special interests, my practice focuses a lot about restoration of function. So urinary problems in men, sexual function problems, and really anything that's related to quality of life.
Thanks, Dr. Gill. Dr. Paulos, you have a unique background for somebody in a urology department. Tell us a little bit about yourself and what's one myth that you often hear about the prostate cancer journey?
So my name is Mark Paulus. I'm an internal medicine doctor. I'm the only non-urologist on the panel. I've been in practice for 25 years. And for the past 12 years of my practice, I have specialized in what's described as andrology and sexual medicine, or men's health, more commonly known. And I've been at Cleveland Clinic for the past year. I'm the former co-director of the Men's Health Center at Brown University. And I see patients at main campus, I see patients at Stowe, and also at Independence. And I'll just add that I have a background in something called lifestyle medicine, using therapeutic lifestyle interventions to improve health and treat and prevent chronic disease. So that's a big part of my practice. And one of the main misconceptions that I hear from men who go through treatment for prostate cancer is, there's nothing I can do. This is something that happened to me, and my doctors are in charge and they tell me what to do, and it can be somewhat of a helpless feeling. And I try to convince them, and we'll make the case today, that there are lifestyle interventions that can be made that can both help to prevent prostate cancer, but also help men to feel better and have better outcomes after their treatment, so they can take back control of their own health.
Thank you, Dr. Paulos. It's such a pleasure to be here with just part of our Cleveland Clinic Men's Health team. We have a multi-specialty team that really tries and strives to provide holistic and comprehensive men's health care. So it's great to be with you guys today. For those of you out there that don't know me, again, I'm Dr. Peter Bayich. I'm in my 6th year here at Cleveland Clinic. My areas of focus are male sexual dysfunction and male urinary dysfunction. I see patients at the main campus downtown and also Independence Family Health Center. One myth that I often hear about prostate cancer recovery is, unfortunately from my patients, sometimes I hear that there's nothing we can do about something like incontinence. I think it's a common misconception that sometimes some of these men who had treatment 20, 30 years ago have just been living with these issues all this time, and they are under the false perception that it can't be fixed. And I think this echoes a lot of what others have already said, but we really want to provide the education needed to all the folks out there who might be suffering that all these problems do have solutions, and that we want to provide you with the necessary support and the necessary information so that you can get the help that you need. So moving on from the introductions, it's time to answer your questions. In advance of this session, we've actually received hundreds of questions. We will try to answer as many as we can, but certainly invite you, for those of you who were not able to get your questions answered today, to come and see us and our colleagues in person to make sure that whatever your concerns are, that they're heard and addressed. So let's get started with the first one. Dr. Bolle, what can most men expect after radiation treatment?
I think most people going into radiation treatment are expecting not to have too severe changes in their urinary function. And so I think it can be sometimes disconcerting or surprising when they do get those symptoms. And so what I'd like to say as a urologist is not to be alarmed. Tell your radiologist right away, and if you have a urologist as well, and hopefully you do, tell them as well, because it's not uncommon to get some kind of urinary symptoms like frequency, urgency, maybe a little bit of burning, or maybe even a little bit of trouble urinating in that first 1 to 3 months after radiation. That will usually get better in that first 3 months or so. Sometimes it can go out to maybe about 6 months, but it really should calm down. That flare should calm down within the first year. It's possible sometimes after a year to get a little bit of a flare later on, but mostly those symptoms are mild and they should resolve long term. Now, it is possible to sometimes have severe urinary symptoms, like a lot of blood in the urine, or a real difficulty with scar tissue that develops as a long-term effect of radiation. Now, that's not as common. And so if you are noticing bothersome symptoms like that, you should let your urologist know. You should let your radiation oncologist know. But I would say in the short term, it's not uncommon to have some symptoms that should subside.
Absolutely. And is this for the radiation seeds, also known as brachytherapy, or external beam radiation, or both?
I would say for both. There is a little bit of inflammation that happens anytime you have any kind of procedure in your urinary tract, and radiation is the same. So whether you have seeds that are implanted or you have external beam radiation, it is certainly very possible to get some inflammation in that urethra, in that prostate, in that bladder. Even though those are not the areas that are being targeted, the bladder and the urethra can get irritated, and just even temporarily you may benefit from going on some medication. So again, talking to your doctor about what options you have and how bothersome your symptoms are is going to be very important to stay comfortable as you're recovering.
And can men experience sexual dysfunction from radiation, and is that only if they also had hormone suppression, or even without that?
Yes, that is also a symptom that I think we don't always talk about or recognize. And again, because radiation is typically quite gentle when you're having the treatment, that it isn't always something that we talk about or focus on in terms of sexuality and sexual function. But absolutely, having radiation can affect erectile health, so the strength of your erections. You might notice a decline anywhere from usually 1 to 3 years is possible, where it might have been okay in the beginning, but you start to notice that you're losing a little bit of firmness. And if I had to put a number on it, there's a lot of variety, but on average you could say maybe about 50% of people after radiation might experience some loss of their erectile strength. Separately from that, but still related to sexual function, is the possibility of dry orgasm. So when you get radiation to the prostate, that is going to cause some changes in the prostate gland and cause a reduction of fluid that comes out with ejaculation. Now, again, that's not something that everyone talks about or even thinks about when they're trying to recover from prostate cancer, but it is important to know that that will probably happen and that the amount of fluid that comes out with climax could be reduced or just entirely gone. And that would be a function of the treatment itself. To your question about hormone therapy, Dr. Bayach, I think it is important also just to know that with hormone suppression therapy that's done for some period of time in conjunction with radiation, we very often expect to see changes in libido, so the desire for sex or sexual arousal, which is a big factor in terms of how easy or difficult it is to get a strong erection. And that's something we can definitely talk a little bit more about today.
Very good. Thank you so much, Dr. Bolle. So Dr. Gill, how does prostate removal affect sexual and bladder function?
And so to piggyback off of what we talked about with radiation, one of the things I make sure all patients know is that every treatment has side effects, because you'll see a patient who's had radiation and they'll say, well, I really wish I would have had surgery. You'll see a patient who's had surgery and they say, well, I really wish I've had radiation. So every treatment has some type of side effect. And with prostate removal, those side effects happen up front. They happen at first. So, you can go in, you can try in some cancers to peel the nerves that make erections off of the prostate and try to preserve erectile function. But those nerves, when you peel them and they get stretched, they stop working for a little while. So a number of men will have those erections, if the nerves can be saved, recover to some degree, but they may still need help from a medication or something down the line, potentially a surgery or another treatment to help with erections. On the bladder side of things, we've gotten very good with robotic surgery especially at being able to zoom in and try to preserve and keep that sphincter muscle that holds the urine in place. That being said, same type of situation. You're in there, you're very careful, you preserve things, but with surgery, tissues get disrupted, they change, there's inflammation. Guys always have leakage after prostate removal too. And depending on the type of surgery that's done, that leakage may last just for a few weeks. It may last up to a few months. But the vast majority of men who have their prostate removed nowadays recover their urinary function. And we're talking in the lines of like 90%, if surgery goes well and everything goes smoothly. That definition of recovered urinary function, there's some range in that too. Some people will say, a safety pad a day is considered to be normal control or continence. Other folks say, no pads at all. But we can get into the weeds with that a little bit later.
Thank you, Dr. Gill. So I'll take this next one. How long does it take to regain bladder control and sexual function after robotic prostatectomy, which is the most common type of prostate removal surgery? There's a lot that's been researched in this area and published. And the way I kind of summarize what we know to my patients when I see them is that essentially for urinary control, it can take about a year for us to know how much that's going to improve. I will say these days, the average guy who leaks is probably not as severe of leakage as when we were in our training, and I think that techniques have really come a long way. But men who continue to leak beyond a year, that's where we start thinking about options of what we can do to address that. And certainly there are conservative measures that we talk to our patients about, such as Kegel exercises, working with physical therapists sometimes to help make sure that they're doing those correctly. But essentially beyond that 1 year mark, if one of our patients continues to be bothered by urinary leakage, we're starting to think of more definitive treatment options, of which there are very effective treatments for incontinence after prostate removal. The most common ones that we're talking about are usually urinary slings and artificial urinary sphincters, which are procedural therapies that are highly effective and very well tolerated, and is something that we have several specialists within the Cleveland Clinic Department of Urology. When it comes to erectile function, it takes a little bit longer. Okay, so at least about 18 months or so is usually what I would tell my patients. There are some cases of recovery of erection function even out to 3 to 4 years. However, what I usually tell my patients is if you haven't recovered much of any function by that 1 year mark, even out to 18 months, the likelihood of having substantial improvement beyond that is quite low. However, for those who have recovered most of their function but might not be completely back to baseline, those are the ones where sometimes a little bit more waiting can result in additional improvement. But in general, like I said, about 18 months. Some men who had erectile dysfunction before their prostate was removed may be more likely to experience worsened erectile dysfunction after. So one of the predictors of having erection troubles down the line is what were they like before the prostate was removed. If you have excellent erections going into a prostatectomy, you're going to have the best possible chances of maintaining those erections, especially if your cancer is confined to the prostate in a way where the nerves on both sides can be preserved. And we certainly have patients who go through prostate removal, I think we've all seen these, where their erections really weren't impacted at all, where they have excellent and even perfect urinary control. And that's all an individualized discussion with the prostate removal specialist, who's a urologic oncologist, about your individual factors that might give us an idea of what is the likelihood that you might have these types of issues. Moving on to the next question, Dr. Bolle, what are the options for erectile dysfunction treatment after high-intensity focused ultrasound, or the HIFU procedure? The individual asking this question did not have erection issues prior to the procedure.
With prostate cancer, we typically know that the way the cancer is in the prostate gland, it has little roots and it goes out into the prostate gland in areas that we can't always visibly see. But the thought behind HIFU, for listeners who aren't as familiar with it, is if you have certain spots where you feel very confident that the prostate cancer is localized, can you target those spots with the high intensity focused ultrasound and avoid having to treat the entire prostate? And so I do think that there is a thought and a goal behind treatment like that perhaps it won't affect erections quite as much. There are research studies looking at people who had HIFU done on their whole prostate gland, just for context, where there was a fairly high rate of erection problems because the heat from the HIFU still was able to travel to the nerves that control erections that we were just talking about, and the blood vessels, and still cause damage to those areas. But in men who have been able to have a more focused area treated, that rate of causing erection problems is lower unless the cancer that was being treated was more so on the edges of the prostate gland where the nerves could still have been affected. And so I think when we think about the risk of having erection problems after HIFU and what kind of treatments might be good for that individual, it matters why it's happening. So did they get heat damage to the nerves or some kind of damage to the nerves? Or is it some kind of damage to the blood vessels? And then what part of it was pre-existing from maybe some medical conditions like diabetes or high blood pressure that existed beforehand that made this person maybe a little more susceptible to the effects of the HIFU treatment. So in general, if the issue is that there is not good enough blood flow coming into the erection and the issue is a little more on the mild side, then I would say it'd be very reasonable to expect success from something like pills. So sildenafil, tadalafil are the generic names for Cialis and Viagra, and those are very reasonable if we're assuming that the issue is just a little touch of a blood flow problem due to the HIFU. On the other hand, if we're worried about nerve damage, pills may not be as effective at treating nerve damage, and in those gentlemen, it may be more effective to go to a stronger medication, for example, the injectables that can bypass some of that nerve damage, or in very severe cases, to talk about a surgery like the penile implant. So it does matter what the mechanism is of why the erection problems are happening, and I think there are options in either case.
So what I'm taking from what you're saying is that it's not so much that this specific technology is the concern for the erections, but more so how it was used, where the cancer was, and the individual features about that patient's problem that would kind of maybe predispose them to that and might also guide what some of those options are. Now, you mentioned injections and implants. Do you always have to try injections first before considering a penile implant for the treatment of erectile dysfunction?
No, that's a good point. And so generally speaking, we want to lay out all the options to anyone coming into the clinic to talk about erection problems, and then go through the pluses and minuses. And I think we all do this, trying to really show someone what each of these treatments is going to mean for their daily life. If someone comes in and says, I hate needles, and the idea of doing injections is just would completely ruin the romantic mood, that's not going to be someone that we're pushing injections on by any means. If it's someone who says, there's just no way I'm going to be able to remember 1 hour before to take my pill, then they may need a little more spontaneity. And so I do think it is important to talk to the person sitting in front of you and really understand what's going to work for them on a daily basis or on a more frequent basis.
Dr. Paulos, how can I mentally focus on well-being and start feeling better now that the cancer is over?
I was excited when I saw this because I think it touches on some really important points, really specific to survivorship in general. And I made the statement that some men feel kind of helpless when they get a diagnosis and their hands are their life is in the hands of their doctor, and they lack control. And when men finish treatment for cancer, there may be this expectation that there's going to be a sense of relief, like the cancer treatment's over, things are going to be better, and their life is going to somehow improve. And for many men, that doesn't arrive. That feeling never arrives. And the sudden loss of structure, all of the checking, all of the visits, the lab testing, the CT scans, they talk to the nurse, you have a follow-up. Like all of a sudden when cancer treatment ends, that disappears. And in some cases, it can be a little disorienting. Men feel like, hey, I'm on my own now. And then sort of dealing with that and perhaps even dealing with thoughts like, well, what if the cancer comes back? And these are the type of things, now the thoughts that men have as they transition through this period. It can be unsettling and it can, in some cases, even provoke anxiety. So as men finish treatment for cancer, if you're not feeling great about it, even if you've had a good outcome, or if there's some level of anxiety, that can be a normal thing. And so I like to let patients know that. I also recommend going through that transition looking forward. It can be an easy thing to want to, like, I want to get back to my old self. I want to do the things that I used to do. I want to be that same person again. But the truth is, after cancer treatment, things change. Our bodies change. We change through that experience. And rather than looking back and trying to regain, a past function, which can lead to frustration, look forward. I think it's always the best thing to look forward. And to think about, how can I be the best version of myself at this moment, dealing with the circumstance, what I've been through, and thinking about certain health behaviors that matter a lot. Am I exercising enough? Am I eating healthy foods? What's my diet like? Am I maintaining a healthy body weight? Am I drinking too much? Do I smoke? As it turns out, we know that all of those factors have a big impact on how men do after cancer treatment, and particularly after diagnosis. Men who can exercise and maintain a healthy body weight, eat healthy foods, avoid tobacco and alcohol, they do better. They have less recurrence. They do better in the long term, less chance of dying from prostate cancer. So these lifestyle factors matter a lot. And so I kind of put it into the perspective with patients like, hey, now you're entering the cancer treatment, the active treatment's over, but now you're entering the maintenance phase of your treatment. And this is the part of your treatment that you control. And you can choose the foods you eat, and you can add some exercise, and you can really take this over because it's going to help. It's part of the treatment. It's going to help you to do better on the other side of the active treatment. But as it turns out, if you exercise, if you eat healthy foods, if you maintain a healthy body weight and avoid tobacco and alcohol, it's great for lots of things. It reduces cardiovascular risk. It lowers blood pressure. It improves blood sugar and cholesterol levels, and it's good for health. And I remind patients who have gone through treatment for prostate cancer that the number one risk that you'll face to your health going through treatment for prostate cancer is still cardiovascular disease. And you got to think about that. And as you're looking towards the future and staying healthy and feeling well, you've gone through your treatment. These are the factors that really matter. And back to this idea that there can be a sort of a helpless feeling like going through cancer treatment, the doctors are making decisions, they're recommending treatment. You can kind of wrap your arms around this stuff and embrace it and get involved with it. And by sort of taking back control of this and feeling more in control of your own health, that sense of agency and self-efficacy is actually empowering, and it has a very positive effect on quality of life.
Thanks, Dr. Paulos. Really, really amazing comments. Can you speak a little bit to men specifically, whether it's cultural or personal, just this kind of like macho thing that some guys have where they don't even want to talk about their health, whether it's with their loved ones, their support system. Can you just speak to the importance of men breaking down some of those barriers as it pertains to cancer and even beyond, being willing to talk to their partner about it, being willing to talk to other men who have been through the same journey and continuing to have those conversations with their doctors and how important that is for their long-term health and for their ability to, continue to be there for their loved ones, like their family and others.
Sure. I see this when I educate men about many of these lifestyle factors. It's empowering them to take control of their own health. Men tend to be independent, and they want to take charge, and they want to fix the problem, and they want to solve the puzzle, and that sort of thing. And if they feel like they don't know or they can't do it, they might resist that type of information. So the way I put it to patients is, I'm empowering you. I'm going to give you the skills. You're going to go and do this. I'll give you some idea about what type of exercise or how much to do. Or, these are foods which may be helpful to your health. These are foods which may be harmful. Here are the resources. You can figure it out. You can work with it. And I find that when I present it in that way, like, I'm giving you these tools to put in your toolkit, but you're going to go and build the house. You're going to go and solve the problem. That men really respond to that, and they accept the information, and they're more likely to apply it.
Dr. Gill, are there any new treatments to help with post-procedure urinary issues?
Unfortunately, there's not really any new treatments per se, but there's treatments that have been around for a very long time that work very well, and maybe some new thoughts about how we can approach urinary problems. So in general, after prostate cancer treatment, if the prostate's removed, men can have leakage problems because that sphincter muscle might not hold tightly enough. And that's where you think about usually a surgery or a procedure or something physical to fix that problem, because it's a physical problem. The artificial sphincter is something that's been around for over 50 years. And then there's the male sling, which is like a little hammock that can hold up the urethra and help that muscle close tighter. Those have been around, they've been studied extensively, they're very safe, they're very effective. There's also other types of leakage that men can have, which is where they have trouble holding the urine because the bladder is irritated. And like Dr. Bolle talked about, radiation sometimes after some years can cause bladder irritation. But the other thing that causes it is just good old-fashioned age. So as a guy ages, their bladder becomes more impatient and more irritable. And that's whether or not they've had prostate cancer or really anything else done. So taking that into account and understanding that, treatments for overactive bladder are really helpful. And the first line there really is what Dr. Polos talked about, which is a healthy lifestyle. So watching out for caffeine, alcohol, sweeteners, flavorings, colorings, those type of things that upset the bladder and make it not want to hold. And then from there, you can think about medications or pills for overactive bladder. And then beyond that, for really bad cases, you can think about nerve stimulators or bladder pacemakers, for lack of a better term, in addition to things like Botox injections. So there's a lot of different tools that we have that we can use to address urinary problems in guys, but it all really comes back to understanding what problem they're having, and whether it's a physical type of leakage because that muscle's not closing tightly, or if it's more of an upset bladder, irritable bladder type problem.
Follow-up question on that. So if a patient came to you, let's say he had his prostate removed 20, 30 years ago, he watched a video like this and heard about an artificial urinary sphincter, what would you tell him that he might expect, going through that procedure as far as outcome afterwards?
It's a very good question. So the artificial urinary sphincter procedure, it's almost like a blood pressure cuff, the little cuff that they put on your arm, except it goes around the urethra, the tube that carries the urine out of the bladder. The surgery takes about an hour and a half to do. You can usually go home the same day, but you don't get better at first. So we got to heal up for about 6 weeks after the surgery to allow the tissues around the device to settle and inflammation and things to go away. After that, you come back for a teaching visit and you're taught how to activate and use the device. And at that point, our goal really for that surgery or any type of a leakage surgery is to get a man down to a safety liner per day. So someone who's using lots and lots of pads each day, the artificial sphincter can help them get that leakage down quite a bit. Those devices are very robust. They've been around for a long time. The benefit for those, you can expect to last maybe 7 or 10 years. And at that point, the device usually is still holding up, but the tissues may start to thin out a little bit inside, and that leakage can gradually come back. Now, throw radiation into the picture, kind of a more complicated situation. Somebody who's had their prostate out and has had radiation. Those tissues aren't as healthy because of the long-term radiation effect. So those patients, maybe they should expect benefit for 5 years, maybe 7 years, then that leakage could come back. But because it's a physical problem and you can fix it with a surgery and the device, you can always come in, go in for another procedure, move the device a little bit and get it to a part of the tissue that's a little more healthy and robust, and then reset that clock. So those would be the big things to expect in terms of outcomes and benefit from one of those procedures.
And just one last quick question. If somebody didn't have radiation, they were having leakage related to prostate removal, and they didn't have some sort of major reason why they couldn't undergo an hour and a half long procedure. Have you ever met a patient like that you felt that you couldn't help their urinary leakage that was due to prostate removal?
There's patients who come from all around to see us. We have a phenomenal urology team, and we have access to a lot of really interesting and helpful technologies. Every patient is different, and unfortunately you'll have some very complicated or some very severe situations where you may need to go in and open up scar tissue or fix a stone that formed in the bladder, really complicated situations like that may take a few surgeries to get somebody better. But there are still some patients who you can't help with surgery and you really want to. But you can come up with other ways to strategize and work on their leakage and maybe use external devices, different things like that, to still improve their quality of life and help them out. But that being said, there's very few patients that we're not able to help get better. And that's really the nice part of our practice and what we do in terms of thinking about quality of life and helping patients is we can help almost everyone.
So even people that have a very complicated history, it's still worth coming, having that conversation with an experienced specialist, of which we have several in our team. I think that's a really powerful point. Dr. Bolle, is there anything a patient can do to help return bladder control after surgery?
Yes, there is actually a lot you can do. We talked a little bit just now about all the really neat and helpful surgical options that are possible, but I think when you're just after surgery trying to figure out what your new urinary status is and what your body feels like, there's a lot that you can do. So the first thing I would say is just pay attention now to what your symptoms are doing and what your body is telling you when you go back to doing your regular activities. For example, are you noticing leakage when you hold your bladder now for too long? Do you notice leakage when you go back to drinking your favorite soda? Do you notice urinary control problems when you're out trying to be on the golf course? And you usually skip going to the bathroom, but now if you do that, you're gonna have some drops of leakage. So first, just try to pay attention to when are you having these bladder control issues. What is it that might be triggering those symptoms? Is there anything that you can pay a little more attention to or modify in your behavior that can very simply take care of those symptoms without having to do much else? For example, going to the bathroom a little more often when your bladder tells you it's time to go. Now, beyond that, it can be very helpful to visit with what we call a pelvic floor physical therapist. We have a fabulous pelvic floor physical therapy team here at the clinic, and they have a special interest in working with men after prostate cancer treatment. And so there's a whole program that they can actually go through talking a little bit more about some of these lifestyle factors, and then actually going into exercises that you can do to strengthen your bladder control. So there's a group of muscles in the pelvic floor that you can learn to recruit to get better urinary control. This is non-invasive. It takes a little bit of work, and it takes a little bit of recognizing where those muscles are and how to best activate them. But they're exercises that you can do at home, and with a little bit of guidance from a physical therapist, they can be very, very effective at getting you much more urinary control than you probably thought was possible without having to do some kind of extra or additional treatment. Now, if you work with a physical therapist, if you're aware of all your triggers and all your habits, and you're still having a bothersome level of urinary symptoms, and it's been some amount of time, so not just the week after, not just 2 or 3 months after, but it's persisting. I would say at that point it would be very worthwhile to talk to one of our urologists and surgeons to say, is this the point at which I should be looking into something more? and which of those options, like what Dr. Gill was mentioning, might be something I should do more research into at this point.
Is there any benefit potentially to even doing exercises before prostate removal?
Yes. So that is something that we call prehab. So before you even have surgery, there is research that shows that you can have a better outcome after surgery if you start strengthening those muscles beforehand. And again, this is something that can be unique to different hospital systems and different doctors' workflows, but we're very lucky here to have a physical therapy team that does offer prehab for patients before prostate surgery. And of course, the level of, I think interest for our patients is going to be different depending on how worried they are about having urine problems after surgery, what their individual risk factors are. So someone who, maybe already has a little bit of urine control issues, for example, might be a little bit more at risk for having those same issues after surgery. They may be more motivated to go get prehab done. So it's not mandatory, but we are very lucky that we have PTs with us who work with us very often who offer that kind of treatment. And I would highly recommend it to anyone who is wondering, what can I do to sort of prepare my body for surgery and get me the best possible recovery afterwards?
Dr. Paulos, back to you. This next question is about naturopathic products. Are there any that are helpful for urinary and sexual health, or are those things that you recommend to your patients to stay away from?
There are certainly a lot of things that can be done throughout cancer treatment, honestly, specifically to bladder function and sexual health, that can be helpful, that don't involve taking a pill. And very frequently our patients are overloaded with medications. And the usual experience, you go to the doctor and you get another pill for something else. And you end up with a medicine cabinet full of things. So patients ask very often, like, what can I do to get this better without a medication? Some of the things that we've touched on, the thing that has the greatest impact across the board is movement, is physical activity. Specifically, if we're thinking about sexual function. And this is true in men, just of all men, that aerobic exercise has a very wonderful effect on sexual health. It benefits cardiovascular health, but it benefits sexual health tremendously. So as men go through treatment for prostate cancer, for instance, if they're getting hormone therapy, hormone deprivation therapy, their testosterone's down, their libido's down, what we see is that one of the most effective interventions is it's exercise. It's a combination of aerobic exercise and some resistance training. And what that does is it stimulates libido, the sex drive comes up, erections can be better, so it's very effective. Men who have completed treatment for prostate cancer may have gone through a surgery. There's still benefit of adding the exercise and the movement. So that part of it I emphasize for many reasons, but it's specifically helpful in this case. There's actually some interesting research where they looked at a yoga intervention for men who had gone through radiation therapy and looking at effects on sexual health, and there was some benefit. And I think the take-home message is not necessarily that yoga will cure erectile dysfunction, but rather that it just reinforces this idea that movement and physical activity is always beneficial. And when it comes to urologic health or continence, we've touched on this, but I'll emphasize it because it is so important. The mainstay of that treatment is again, movement. It's pelvic floor physical therapy. That's really what has the greatest impact. That's what men do the best with that. And what I'll add to that is just, again, to kind of reinforce some of this, there are a couple of smaller studies that looked at doing Pilates as an intervention to improve bladder control. And small studies, but nonetheless, they showed that there was benefit almost as good as pelvic floor therapy. So back to this idea that movement, core strengthening exercises, increasing tone in the pelvic floor, it can be really helpful. So those are specific to sexual function and bladder function. But as men go through cancer treatment, there are a lot of what we consider non-traditional, or this sort of integrative approach to treating symptoms of cancer treatment, which is really important and can be really effective. And there are treatments like that are available, like massage therapy, or it's called Gijang. It's Chinese martial arts, somewhat like Tai Chi. Specifically, there are interventions like guided imagery and like progressive muscle relaxation that are shown to address anxiety, to improve mood, to boost energy, in some cases to lower pain, to treat nausea. So there are many things that can be done to treat symptoms as men go through their journey of treatment. A lot of those are available here at Cleveland Clinic, as it turns out, which is really wonderful. Even music therapy is being introduced as something that can improve quality of life as men go through, or people go through treatment for prostate cancer, as people go through treatment for cancer, but as men go through treatment for prostate cancer specifically. So there's quite a lot that can be done. I tend to not recommend supplements. The short story on that is there's not a lot of evidence that they do much. We know that getting nutrition through food is always best. We have been thrown off in the past with observations that men who get lots of zinc in their diet or selenium in their diet or have a high intake of lycopene, that there's some benefit in terms of prostate health. And then we distill the food down and we take out the zinc and the selenium, we give it as a supplement, and it has a very unexpected effect where they actually don't do well by taking those supplements. Or eating tomatoes is good, but the lycopene in the tomato, when it's distilled out and given as a supplement, it doesn't have that same effect. So we've learned that lesson. I always recommend like nutrition through food, improving diet, work with a dietitian or nutritionist. I generally don't recommend supplements.
Excellent point. And I think the other thing that I hear, or that I find that a lot of patients don't know is, what is the difference between a supplement and a pharmaceutical? It really comes down to testing for safety and effectiveness. So to be an FDA-approved pharmaceutical, it has to go through a certain level of testing to prove that it's safe, that it's not going to hurt somebody, and also that it's effective, that it's doing what it's supposed to do. Supplements do not have those kinds of requirements. There's really no universally applied quality measure of any kind to even prove that what's in that capsule is really what the label is saying. So I always, to my patients as well, to your point, encourage them to exercise caution. I mean, these supplements can be very expensive. There's no proven benefit. Dr. Gill, how long does it take after surgery for urination to return to normal?
When you have prostatectomy done, when you take the prostate out, you leave a catheter or a rubber tube in place that goes through the urethra, through the urine tube, through the penis, into the bladder. And that's to allow the bladder and the urethra to heal back together where they were sewn together in the spot where the prostate came out. When that catheter comes out, everybody leaks for some time. And certain approaches to removing the prostate, some of the newer ones where they go through the bladder, called transvesical surgery, that time where leakage happens may be on the period of a few weeks. It can actually be a pretty quick recovery in some patients. And that's really the qualifier for all of these things, are that every man recovers differently from prostate cancer treatment. So some men will recover very quickly, certain functions. Others, it will take quite some time. And then others, unfortunately, may not recover that function completely. In general, what I tell men about prostate removal or prostatectomy is that you're going to have, the first month or so after surgery, a good bit of leakage, and you'll need a good number of pads. And then as time goes by, out to maybe that 3-month period or so, you'll really start to see things slowly recover and improve. And the number of pads they use will steadily kind of decrease. By about 6 months out from surgery, you have a fairly good idea of how your recovery trajectory is going. And traditionally speaking, we'll tell everybody, give it a year, give it a full year to see how things recover, to see what you come back to in terms of urinary control. I think that's very fair, but also if there's really severe leakage at 6 months out, the likelihood of getting more recovery from that 6 to 12 month time frame is pretty low. So, you kind of have to be real in your expectations. And I say that because if someone has pretty profound leakage 6 months after surgery, I don't want them to wait to seek care until that 12-month point, right? Come in, see somebody, talk to somebody, find out what your options are to get better.
For a patient who, let's say, had a more aggressive form of prostate cancer that was undergoing prostate removal, and based on the type of prostate cancer they had in the location of it, maybe the nerves could not be spared on either side. We talked about how men after prostate removal, we have a certain timeline that we expect the erections to recover. If the nerves are removed on both sides, does a patient have to wait until 18 months to have a definitive treatment for their erection issues, assuming the pills aren't working, which probably in that scenario they wouldn't?
Yeah, that's a great question. So shifting gears a little to the erection side of things, I have the same perspective. Even if those nerves have been preserved in surgery, it goes back to everybody having that different recovery. Usually if erections are going to come back, you expect to see something maybe by that 6-month time point, a little bit of swelling or what we technically call engorgement, something like that. 9 months out, if nothing's really happening, by a year, it's unlikely that the erections are going to fully return. So yeah, by all means, you can seek treatment for erection problems after prostate cancer surgery really at any time. And one of the other things that's just food for thought is do you have to wait to seek out pills or injections or things like that, the non-surgical treatments, soon after the prostate comes out? And once you're cleared for a return to vigorous activity, some people may consider that to be sexual activity, it's probably safe to use a medication to help with an erection. But yeah, the more permanent solutions like the implant surgeries, which have some benefits like spontaneity and things like that, you can go after those, some months out if there's really no return to function. I don't think there's any downside to that.
Yeah, I completely agree. And we may have some listeners who don't know what a penile implant is. Just briefly, a penile implant is a definitive treatment option for erectile dysfunction. It's really an option for any man who's dealing with erection trouble, who is looking for a permanent fix. And it is a procedure done under anesthesia. It usually takes about an hour or so, more or less. And basically, for anybody who's a candidate for anesthesia and who has erectile dysfunction where other treatments are not viable or are not working out, it's an option. So it's something we're commonly talking to our prostate cancer survivors about. It's something that our group has a lot of expertise in. And if that's something you want to learn more about, we have a lot of good content online through Cleveland Clinic about it, and also something that you could always come in and discuss as well. Dr. Paulos, this is a question about negative thoughts after prostate cancer. So how can a patient navigate those? This patient specifically states that he can't understand why me. I'm having a challenging time. What guidance can you provide?
This is something that comes up actually quite commonly. And I think an important point to make is that it's normal. It can be normal to feel this way. Negative thoughts are going to happen. They can happen in life, but they can happen when there's any health issue that takes place. And and it's okay. Like when bad things happen, it's okay to feel bad. And when sad things happen, it's okay to feel sad and frustrated. And rather than resisting the negative thoughts that come in, it's a good exercise to let it be, to give it space. Honestly, going through cancer treatment is a challenge. And allowing space for the full spectrum of emotions that human beings feel is really important. If you're angry, if you're frustrated, if you're sad, if you're disappointed, whatever that is, you give it some space and let it be there. I mentioned in the past that men tend to have this tendency, like they want to know, like what's solve the problem, fix it, take control of it in some way. And this like, why did it happen to me? Maybe I could have done something to prevent it, who knows? And the truth is that answer might not ever come. There are genetic factors, there are environmental factors, there are so many things, age, that can lead to a diagnosis of cancer. And so one may never get that answer. And that's frustrating. And that can be particularly frustrating for some men. And but allowing that, acknowledging it's frustrating, I might not get an answer, but you can let that be and just give that some time and sit with that. And then the next step, so how do you navigate through this? I would say that once you sort of get through that first layer of like, I'm really not feeling good about any of this, is to use curiosity as a really powerful tool, and to begin to investigate and think, well, why do I feel this way? Disappointed, betrayed, whatever that might be. And is it because I'm tired all the time? I look out the window, my neighbors in the yard, they're doing fun things, I can't do that. Is it because I can't get an erection or I'm still leaking urine? Or is it because I lost muscle mass and I'm weak and I can't do my job? And it's a different answer for everyone who goes through this, but you kind of get curious about it, like what is really the root cause of the unhappiness? What's driving this? And then as the next step, you let your curiosity lead you to what the solutions might be. Like if there's fatigue, as an example, could I do a little walking to boost my energy? We know that helps. If there's loss of muscle mass, we call that sarcopenia. There's actually significant health risks involved with that. Men who go through hormone therapy can experience that. Can I work with a nutritionist? Can I increase my protein intake, or work with a physical therapist or with a trainer? Or if I leak urine or can't get an erection, what is available? We've heard about all these great treatments, but allow the emotions to be there. Don't resist them. Give them some space. Engage with them. Get curious about it. Think about how things are really affecting you. What's the root cause of the dissatisfaction that you're feeling, and then let curiosity take you to what the right treatment's going to be, the right specialist, or possibly the right lifestyle intervention.
I'll take the next one here. So the question is related to patients who have undergone prostate removal. Is there any treatment to stop urine ejaculation during sexual intercourse? So I think this is a really important question that probably doesn't get talked about enough. But men who undergo prostate cancer treatment particularly prostate removal, might experience leakage of urine during sexual activity, or potentially specifically during orgasm, sometimes even just during sexual arousal. Arousal is what happens in the mind when you kind of get turned on, so to speak. So I've had patients tell me that their wife kisses them on the cheek and they start dripping urine. This is something that men can experience after prostate removal. There's different terms that have been used. We talk about arousal incontinence. We talk about climax-related incontinence or climacturia. The broader term that I like to use is sexual incontinence, so anything, any type of leakage related to sexual activity. This is something that happens that actually in the majority of men at some point will happen, but usually goes away. Okay, so it's more common in the earlier days after prostate removal. And if it doesn't go away, and if it's bothersome, it's something that can be treated. There's a number of different things that we can do depending on the specifics. So for some of my patients who leak just during sex, some of them get by with just urinating before sexual activity. Others, that may not be enough, and we might talk about things like physical therapy. There's actually devices that can be used that kind of are almost like a rubber band that can go around the base of the penis to prevent leakage. And then there are surgical options. Dr. Gill talked about the urinary sling, which can be an option for men experiencing leakage related to sexual activity. And we touched on penile implants briefly, but some of our patients who have erectile dysfunction, who are looking for a permanent fix and ultimately choose to undergo a penile implant, might want to have something done potentially also to treat their leakage, and there are modifications to that procedure we can do to address the leakage as well. So all things that we're used to talking to our patients about, all things that are worth bringing to the attention of your partner, your support system, your physician, so you can kind of start that path towards getting the necessary treatment you might need to get those issues addressed. Dr. Bolle, next question's for you. What can I do about incontinence 1 year after surgery? It is negatively impacting my state of mind and quality of life.
I think there are two really important parts to this question. One, the timing. So Dr. Gill has talked about, at what point should this be something that you bring up with your doctor? This gentleman is talking about 1 year out from surgery, still having bothersome leakage. I would say it's important for him to know that this would most certainly be a time where we would have expected some improvement in urine leakage after having surgery. So if that improvement has not been good enough, if your activities are impacted, and if your emotional state is being impacted, it is time to talk to your doctor about it. Even before that, hopefully if you have a loved one, a spouse who you can talk to about it, it may be helpful to tell them how you're feeling. And I think that can help with even going to the doctor, just having someone next to you who knows your story, who knows to remind you if you forget to mention one of the symptoms that you're having, to be on your side when you go into that office, because it can be scary to go to see someone you don't know and start talking about something that you're not used to talking about. But I would say that's one important thing is 1 year out. I would say that I would want you as my patient to come in and tell me what's going on. And then at that point, we can talk through some of these options. If you haven't done any kind of pelvic floor training, is that something that you could have optimized? Or is this more severe than that? Is this something where you have tried multiple options and we need to be talking about something a little bit more definitive, like one of the surgeries? Or do we just need to talk about what expectations are? Maybe it's just a few drops of leakage, but it's bothersome and you just haven't mentioned it to anyone before. So I think it's really important if it's 1 year out that you talk to your doctor about it. The second important thing I think about that comment was just the fact that it's negatively impacting this gentleman's state of mind. It's so easy, as Dr. Paolo said, to feel very helpless and down and alone about recovering from prostate cancer. And I want to just go back to that first myth that I talked about, which is that you don't have to deal with prostate cancer alone. There are so many people who go through this, who come out the other end stronger and better for it because they've mobilized all the resources, they've talked to their friends and family who they feel comfortable talking to, and they have gathered a support team of people around them who can help them get through it. And I think it's so important to identify those people as early as you can and as early as you feel comfortable to get them on your side, because going through this should not be an isolating process. And I do also want to mention certain even doctor's office visit types that can be done to, I think, dispel some of that sense of isolation. Dr. Paulos has a particular visit type called a shared appointment. If you want to share Dr. Paulos for prostate cancer survivorship, that is a really neat and unique thing that we have here at the clinic.
Oh, sure. So thank you actually for mentioning that. There is something that I talk to men a lot about. I think you've referenced is the value of peer support. And men can learn from each other and share really useful information and shared experience. It's really one thing to hear from physicians about what's happening, but it is often a far more powerful thing for men to hear from other men who have walked a mile in their shoes and understand what that's about. So we are sponsoring these shared medical appointments where groups of men come together. They get some information from their provider about different types of treatments or a particular health topic. And then they get to interact, they get to ask questions. And the neat thing is, among the group, you can be sure that if you're in that group, that somebody is going to ask a question that you didn't think about. You're like, wow, I'm glad they asked that. And you'll get a good bit of information, and there's so much support and learning that happens between the participants in the group. So we're really excited about being able to offer this for patients.
Thank you both. Dr. Paulos, Dr. Boley kind of touched on this with the value of having a partner there in the case you just mentioned for a discussion of urinary issues. I always refer to my wife as my accessory brain. Could you speak a little bit on the sexual dysfunction conversations? Do you find in your practice that it's valuable for the partner to be there and involved in the care of sexual dysfunction?
I do. It's very important. But I always like to set the context, though, when I talk to patients about sexual health and find out, do you have a partner? We tend to have a perspective that I think we assume that as older men go through treatment for prostate cancer, that they will have a supportive wife that is part of their life and will come with them. And if they do, that's fantastic. But very often patients will have male partners. And we need to, perhaps we adjust a little bit what we ask them about or tell them about. So it's important to know about that. There are some men that don't have a partner, but might still be interested in sexual function. Hey, I don't have a partner, I'm dating, and this is, I'm interested. There's a different perspective on that too. So yes, it's very valuable. I like to know the context for the discussion first, and then having the partner, if they're available, is always adds an extra level of support.
Thank you so much, and thank you to you all for what I think has been a really broad and comprehensive discussion. So many important topics were covered. Our panelists have tapped into their various areas of expertise, and I think our whole department here at Cleveland Clinic, we really have the whole breadth of different specialists to try to best support our patients. We're always looking for new ways of bringing those resources to our patients. Our urologists at Cleveland Clinic's men's health section provide individualized care and treatments of various medical conditions, not just prostate cancer and the consequences of prostate cancer specific to men. We provide care at many locations all across Northeast Ohio. We provide virtual visits and even beyond. So if you need us, we'd be honored to help you. We'd be honored to see you and offer you our services. So before the end of the week, you'll receive an email with additional resources, details on how to make an appointment, a short survey about your experience with this program, and a link to a recording of this event so that you can view it again. So if you have more questions or would like to schedule an appointment, feel free to call us at 216-444-5600. I want to thank you all again for watching, and we look forward to seeing those of you who need us in person sometime soon or virtually. Thank you.